What if you've been treating the symptoms your whole life and nobody ever looked for the cause? What if your depression isn't just a serotonin problem? What if your anxiety has a metabolic root? What if the reason that your medication stopped working or never really worked has something to do with what's happening in your body and not just your brain? There is a new field in psychiatry that is asking those exact questions, and I think it might be what a lot of people have been waiting for. Hi. I'm Dr. Dona, youth and adult psychiatrist and obesity certified trained physician, here to discuss all things mental health and wellness related. And today I wanted to introduce you to something that I'm genuinely passionate about. It's metabolic psychiatry. What it is, why it matters, who it's for, and honestly, whether it might be exactly what you or someone you love has been missing. Because this is the kind of medicine I practice every single day. And I believe it represents the future of what we treat in mental health. So let's get into it. So let's start with the basics. Metabolic psychiatry is an emerging field, and I want to say emerging because it's relatively new, but the science behind it is not new at all. It's been building for decades. What's new is that we've been finally putting it together and giving it a name. At its core, metabolic psychiatry is about recognizing that your brain is a physical organ, and like every other organ in your body, it depends on your metabolic health to function well. Metabolism isn't just about weight. Metabolism is about how your body produces and uses energy at the cellular level. It includes things like insulin sensitivity, inflammation, blood sugar regulation, mitochondrial function, the tiny powerhouse inside every cell. When those systems are dysregulated, it affects every organ, including the brain. The field asks a fundamental question that traditional psychiatry has been slow to ask. What is happening in the body that might be driving, worsening, or maintaining this person's psychiatric symptoms? And what can we do about it beyond just adjusting medications? Nature Mental Health just published a major review on this week, concluding that metabolic abnormalities are highly prevalent in psychiatric illness and may contribute to why so many patients don't respond to standard treatment. This is not fringe science anymore. This is mainstream psychiatry catching up to what biology has been telling us for a long time. Let me give you some concrete examples of what this actually looks like, because I think it becomes real when you see it. Insulin resistance and depression. We now have research showing that insulin resistance, the metabolic dysfunction that precedes type 2 diabetes, can double your risk for depression, even if you have no prior history of mental illness and no diabetes diagnosis. Your blood sugar isn't even in the diabetic range yet, and it's been already affecting your brain chemistry. That is a huge deal. And most psychiatrists are not checking fasting insulin or metabolic markers before prescribing antidepressants. Inflammation and anxiety. Chronic low-grade inflammation from poor sleep, processed food, stress, gut imbalance directly affects the brain. Inflammatory cytokines cross the blood-brain barrier and disrupt neurotransmitter production. I see patients with severe anxiety who have never checked their inflammatory markers, not once. Thyroid and mood. Subclinical hypothyroidism. Thyroid function that technically is in the normal range, but on the lower end, can cause depression, brain fog, fatigue, and weight gain. It's one of the most misdiagnoses in psychiatric practice and one of the most treatable. I have at least diagnosed thyroid issues within patients probably a handful of times within the past 2 years or so. Mitochondrial dysfunction and brain energy. Brain uses about 20% of the body's total energy despite being only 2% of body weight. It is the most metabolically demanding organ we have. When mitochondria, our energy factories, aren't working efficiently, brain function suffers. Mood, cognition, emotional regulation, all of it depends on cellular energy production. So when I see a patient who has tried 3 antidepressants and none of them worked, I'm not just thinking, which medication should we try next? I'm thinking, what is happening metabolically that might be making this brain resistant to treatment? So who is metabolic psychiatry for? This is the question I get asked most, so let's be really specific. Metabolic psychiatry is worth exploring if you have depression, anxiety, mood instability, or ADHD that hasn't fully responded to standard treatment. If you've tried medications and they work partially, stopped working, or cause significant side effects, especially weight gain or metabolic changes, that's a signal worth investigating. It's worth exploring if you have a psychiatric condition and a metabolic condition. Meaning, if you have depression and also struggle with weight, have pre-diabetes or diabetes, have thyroid issues, have polycystic ovarian syndrome, or have a history of disordered eating or binge eating. These combinations are not coincidence. They share underlying biology. It's worth exploring if you've been told your labs are normal, but you still feel terrible. Normal is a range, and within that range, there's a lot of variability in how the brain functions. I look at labs differently than a standard primary care workup. I'm looking at metabolic markers through a psychiatric lens. It's also incredibly relevant for eating disorders. Binge eating disorder in particular has a significant metabolic component. The same dopamine reward dysregulation, the same insulin signaling disruptions, the same patterns we see in other metabolic psychiatric presentations. Treating the eating disorder without addressing the metabolic piece is leaving half the puzzle unsolved. And for perinatal patients, pregnancy and the postpartum period create profound metabolic shifts. Thyroid changes, blood sugar changes, inflammatory changes, all of these directly impact perinatal mood. This is an area I am particularly passionate about. If any of this is resonating with you, I have a whole channel full of videos on exactly these topics: GLP-1s, ADHD, sleep, metabolic health, and more. Go check them out after this one. So, what does a metabolic psychiatry appointment actually look like? I think it helps to make this concrete because metabolic psychiatry can sound abstract until you understand what it actually means in practice. When I see a new patient, yes, I take a full psychiatric history. I want to understand their symptoms, their history, their medications, their family history. That part is standard. But I also take a detailed metabolic history. I want to know about their weight history, their energy levels, their sleep, their diet patterns, their relationship with food, their exercise habits. I want to know if they have any metabolic diagnoses, prediabetes, PCOS, thyroid issues, and high cholesterol. I want to know if psychiatric medications have affected their weight or their labs. And then I order labs. Not just a standard panel. I'm looking at fasting glucose, insulin to assess insulin sensitivity. I'm looking at thyroid, not just TSH, but full thyroid panel. I'm looking at inflammatory markers. I'm looking at vitamin D, B12, iron deficiencies, because all of these can present or worsen psychiatric symptoms. I'm looking at lipids, hemoglobin A1C, and in some cases, hormones. From there, we build a plan that is genuinely holistic. That might include medication, psychiatric medication, in some cases, metabolic medication, like GLP-1s if it's appropriate. But it also includes nutrition guidance, sleep optimization, movement, stress management, and when needed, therapy referrals. The goal is not to just manage symptoms. The goal is to understand and address what is driving them. And in my experience, when we do that, when we treat the whole person, the results are different. Patients who have been stuck for years start to move. That's what gets me out of bed in the morning. So why this approach is still rare and why it matters. I want to be honest with you about something. Metabolic psychiatry is not the standard of care. Most psychiatry appointments are 15 to 20 minutes, and nobody is ordering a fasting insulin or checking inflammatory markers before prescribing an SSRI. And I get it. The system is not set up for it. But that gap is exactly why I practice the way I do, because I've seen what happens when we slow down, look at the full picture, and treat the body and the brain together. I've seen patients with years of treatment-resistant depression that finally get relief when we address their insulin resistance. I've seen binge eating patterns shift when we address the dopamine and metabolic piece together. I've seen anxiety improve when we found and treated some clinical thyroid dysfunction. This isn't magic, it's biology. And more patients deserve access to a psychiatrist who is thinking this way. So, do you need metabolic psychiatry? Maybe you do. Maybe you've been struggling and the standard approach hasn't gotten you where you want to be. Maybe you have a gut feeling that something else is going on. Maybe you've been told that your labs are fine, but you know your body is telling you something different. If any of that resonates, that's worth exploring. You deserve a provider who is asking those questions with you. If you want to keep learning about this, I have a whole channel here dedicated to exactly these topics: metabolic psychiatry, GLP-1s, ADHD, sleep, perinatal mental health, and so much more. Go check out my other videos and subscribe so you don't miss what's coming. And if you're looking for a psychiatrist who practices this way, who looks at the whole picture, who orders the labs and connects the dots between your mental and physical health, I want you to know that we are accepting new patients at Dona Wellness Clinic, my clinic. We work with patients in Florida, New York, Pennsylvania, North Carolina, and Washington, D.C. The link to reach us is right in the bio. You don't have to keep trying the same things and getting the same results. There's another way to look at this, and I would love to be part of figuring that out with you. I'll see you in the next one.